Welcome to MitoCast by Mito Foundation. We share information and resources to support people with Mito, their families, and the wider community. All content is created by Mito Foundation. AI text-to-voice technology is used only for the production to make our resources easier for everyone to access.
Today we're talking about the signs and symptoms of mitochondrial disease, often called Mito. Because Mito affects energy production, it can show up in so many different ways.
Right, and before we dive into what those symptoms actually look like, can we clear up something? People hear so many different terms: mitochondrial disease, mitochondrial myopathy, mitochondrial encephalopathy, even names like CPEO or MELAS. Are these all the same thing, or do they mean different things?
That's a really good place to start. Mitochondrial disease is the big umbrella term. It simply means there's a problem with how the mitochondria make energy. Under that umbrella, doctors sometimes use words that describe which body system is most affected. If muscles are the main problem, you might hear mitochondrial myopathy. Myo means muscle, so myopathy just means muscle disease. If the brain is involved, you might hear mitochondrial encephalopathy. Encephalo refers to the brain, so that word means brain disease. And then there are specific names like CPEO or MELAS, which describe clusters of symptoms that tend to appear together.
Okay, that helps a lot. So, if someone hears one term from one doctor and another term from a different doctor, it doesn't mean the diagnosis has changed. It just means each doctor is looking at it from a different perspective.
Exactly. And sometimes doctors will also mention a gene name, like MT-ND4 or POLG. That just means they've identified which genetic instruction has changed. And that helps explain why the mitochondria aren't working as they should.
Great. So now that we've cleared that up, can we take a step back and talk about something simple but important? What's the actual difference between a sign and a symptom?
That's a great place to start. A symptom is what a person notices or feels, like fatigue, double vision, or tingling. A sign is what a clinician can observe or measure, like a droopy eyelid, an abnormal heart rhythm on an ECG, or high levels of lactic acid on a blood test. One quick example, feeling dizzy, is a symptom, but finding a change to your heart's rhythm on an ECG is a sign.
That makes sense. So Mito can cause both signs and symptoms, and often a mix of the two?
Yes. Because mitochondria make the energy our cells need, symptoms usually show up first in the parts of the body that use the most energy. That includes the muscles, the brain and nerves, the heart, and senses like vision and hearing. Some people may only have a few symptoms, while others can have many. And even family members with the same type of Mito can experience it very differently.
Maybe we can start with the muscles, since they work so hard every day and are often affected. What kind of symptoms might someone with Mito notice there?
Muscle cells need steady energy to contract and relax. In Mito, people often describe muscle weakness and tiring much faster than expected, sometimes with aching or cramps. Very rarely, severe stress can cause muscle breakdown, called rhabdomyolysis. This can be serious because when muscle fibers break apart, they release proteins into the bloodstream that can damage the kidneys. One of the first warning signs is dark, cola-colored urine, and blood tests show very high muscle enzymes. Rhabdomyolysis is a medical emergency and needs urgent treatment to protect the kidneys.
And what about the smaller muscles, like the ones around the eyes? They seem to be affected often in Mito, don't they?
They are. Two important terms here are ptosis and ophthalmoplegia. Ptosis means the upper eyelids droop, sometimes covering part of the vision. People might raise their brows or tilt their chin up to see better. Ophthalmoplegia is weakness of the eye movement muscles. Instead of smoothly moving the eyes up, down, or sideways, people might need to turn their whole head to follow an object.
And those eye symptoms connect to one of the main types of mito, right?
That's right. They're linked to chronic progressive external ophthalmoplegia, or CPEO. It's defined by gradually worsening ptosis and poor eye movement. Some people only have eye symptoms. Others have extra symptoms like swallowing difficulty, known as dysphagia, limb weakness, balance and coordination problems, called ataxia, hearing loss, or mood changes. When these extras are present, clinicians often say CPEO+. Dysphagia happens because the muscles and nerves that move food from your mouth to stomach are energy hungry. When they're weak or poorly coordinated, food can feel stuck, and choking or coughing can happen during meals.
And another type that often comes up alongside CPEO is Kearns-Sayre syndrome, or KSS. Can you explain what that is and how it relates?
KSS actually builds on CPEO. It's defined by 3 features: onset before age 20, CPEO, and pigmentary retinopathy. On top of that, at least one other sign is usually present, like complete heart block, high protein in spinal fluid, short stature, hearing loss, dementia, or hormone problems. High protein in spinal fluid is a lab sign suggesting stress on your brain or nerve tissue. And complete heart block means the electrical signal from the top chambers of the heart isn't reliably reaching the bottom chambers. People may feel dizzy or faint, and an ECG shows it clearly.
So CPEO and KSS share those eye features, but KSS brings in more systemic symptoms. What about LON? Because that's another eye-related type, but seems very different.
Yes, Leber hereditary optic. Neuropathy, or LON, affects the optic nerve, the cable that carries visual signals from the eye to the brain. The typical story is sudden, painless blurring in the center of vision in one eye, followed within weeks or months by the other eye. The ability to see fine detail drops sharply, often to the level that meets the legal definition of blindness, even though side vision and light perception may remain. Early on, an eye exam can look close to normal, but later, the optic nerve looks pale because the nerve fibers have degenerated. One young man explained it felt like someone had smudged a thumbprint right in the middle of everything I tried to look at.
And pigmentary retinopathy. That's not the optic nerve, but the retina itself, isn't it?
Exactly. The retina is the light-sensing layer at the back of the eye. In pigmentary retinopathy, the retina shows a salt and pepper appearance when examined. People often notice trouble seeing at night and gradual loss of side vision. One person shared that they could walk into a bright supermarket fine. But the moment the lights dimmed outside at night, they felt like the world just disappeared at the edges.
Now let's shift to the brain and nervous system. What kinds of symptoms come up most often there?
Several symptoms can show up when the brain and nerves don't get enough energy. One that people often hear about is seizures. These happen when groups of brain cells send out sudden, abnormal bursts of electrical activity.
And seizures can look really different, can't they? It's not always the big shaking movements that people picture from movies.
Exactly. Some people do have jerking movements of the arms or legs. Others go stiff all over. But sometimes it's much quieter, like staring blankly or briefly losing awareness. Afterwards, people often feel wiped out, confused, or just need time to recover.
What about balance and coordination? I know that comes up a lot too.
Yes, that's called ataxia. It means poor balance and coordination because the cerebellum, the part of the brain that smooths out movement, isn't getting enough energy. People may stumble, overshoot when reaching, or spill drinks often, not because they're clumsy, but because their movements aren't finely tuned.
And there are movement symptoms as well, right?
That's right. Dystonia is one. It's when muscles tighten or twist without control. For example, a hand might cramp into a fist while writing, or the neck might pull to one side. Neuropathy is another. That means the nerves that carry sensation and control muscles are damaged. People can feel tingling, numbness, burning pain, or weakness in their feet and hands.
And it's not just the nerves we think about for movement, is it? The ones that control automatic things like sweating and heart rate can be involved too.
Exactly. Those are called the autonomic nerves. When they are affected, some people sweat too little or too much, and they can feel overheated or chilled really easily.
Where do stroke-like episodes fit into all of this?
These are a hallmark of MELAS, short for mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes. When we say stroke-like episode, it can look very similar to a stroke, which doctors often call a cerebrovascular accident, or CVA. In a CVA, the problem is usually a blocked or burst blood vessel in the brain, which cuts off blood flow to a specific area. That's why stroke symptoms often match one exact blood vessel territory.
So, how is it different in MELAS?
In MELAS, stroke-like episodes aren't caused by a blocked artery. Instead, a region of the brain has an energy crisis because the mitochondria can't produce enough energy for the cells to function. On brain scans, doctors see changes that don't line up neatly with one blood vessel territory, and that difference is what helps separate them from a typical stroke.
And MELAS has another big feature too, doesn't it? Lactic acidosis.
That's right. Normally, our mitochondria use oxygen to turn food into energy very efficiently. But when they can't keep up, the body switches to a backup system that doesn't use oxygen as well. This backup system makes lactic acid as a byproduct. And when too much lactic acid builds up in the blood, it throws off the body's balance. That change in pH can make people feel very unwell. Symptoms include nausea, vomiting, stomach pain, fast or deep breathing, as the body tries to get rid of the acid, and an overwhelming sense of fatigue. Doctors pick it up on blood tests, which show high lactate levels. And while MELAS is known for those sudden episodes and lactic acidosis, the senses can also be affected. One of the more common changes people notice is hearing loss. It's usually sensorineural, which means damage to the inner ear, or the nerve that carries sound signals to the brain. People may notice muffled sounds or trouble following conversations, especially in noisy places. One man described it as feeling like the world was on mute, unless someone was standing right in front of me.
So MELAS ties together symptoms in both the brain and the muscles, plus those sudden episodes. That must make it one of the types of Mito where understanding the symptoms really helps people and families manage day to day.
Exactly. And MRF is another cluster. It stands for myoclonic epilepsy with ragged red fibers. Myoclonus means sudden, brief muscle jerks that can be triggered by light or movement. Seizures are common too, along with ataxia, neuropathy, hearing loss, and muscle weakness. The ragged red fibers are a lab sign seen under the microscope when a muscle sample is stained. They show clusters of abnormal mitochondria inside muscle cells.
And Lee syndrome, where does that fit?
Lee syndrome usually starts in infancy or childhood. Children may have developmental delay or even regression. For example, learning to walk and then losing that ability later. Ataxia and dystonia are common, along with weak muscles and feeding difficulties like reflux or constipation. Vision and hearing can also be affected. Because Lee syndrome can impact so many systems, symptoms differ depending on when it begins. Earlier, Onset often means more severe developmental symptoms, while later onset may bring more movement and coordination problems.
And finally, NARP. That's neuropathy, ataxia, and retinitis pigmentosa. What does that look like for people?
NARP brings together nerve symptoms like tingling, burning, or numb feet and hands, balance and coordination problems from ataxia, and vision loss from retinal changes. Some people also develop developmental delays, seizures, or thinking and memory problems. The severity depends on how many of their cells carry the gene change, so it can range from mild to much more noticeable.
That's a lot already. But Mito doesn't just affect muscles, eyes, and the brain. What about the digestive system? For people often ask about gut symptoms.
They're very common. The gut relies on both muscles and a network of nerves called the enteric nervous system to move food along smoothly. When energy is low, that movement can slow down or become irregular. Reflux and vomiting can happen when the valve between the esophagus and stomach doesn't close properly. Gastroparesis means delayed stomach emptying. People feel full after just a few bites, may bloat, or vomit undigested food hours later. Further down, constipation is common, or the gut may alternate between constipation and diarrhea. Intestinal pseudo-obstruction is a severe form where the bowel behaves as if it's blocked, with pain, swelling, and vomiting, even though scans show no blockage. Over time, these symptoms can cause poor weight gain, or what doctors call failure to thrive in children.
So gut symptoms are really about energy-hungry muscles and nerves not keeping up. What about the heart? That must be another organ that relies heavily on mitochondria.
Absolutely. The heart is one of the hardest working muscles in the body, pumping non-stop day and night. Two big patterns show up in Mito. Cardiomyopathy means the heart muscle becomes weak or enlarged, making it harder to pump blood. Symptoms include breathlessness, fatigue, dizziness, and swelling in the ankles. Then there are conduction problems, also called arrhythmias, which are electrical faults in the heart's rhythm. Heart block, which we mentioned with KSS, slows or stops the signal between the top and bottom chambers. Other arrhythmias can make the heart race or beat irregularly. People may notice palpitations, lightheadedness, or fainting, and an ECG, or heart monitor, confirms the rhythm problem.
And what about the hormone systems? This one often surprises people. How does Mito affect that?
The endocrine system, that's the body's network of hormone-producing glands, is very energy dependent. Hormones are like messengers, carrying instructions that help control things like growth, blood sugar, puberty, stress, and calcium balance.
So when energy is low, those hormone signals can be affected too. What would someone notice first?
One of the more common symptoms is diabetes. People might feel unusually thirsty, find they're needing to urinate a lot, or just feel very tired. When doctors check blood tests, they see high blood sugar, which confirms what's going on.
And growth can be impacted too, right?
Yes. If the body isn't making enough growth hormone, children may end up shorter than expected for their age. Doctors call that short stature, but at its core, it simply means the body hasn't had the energy signals it needs to grow as it should.
But what about puberty and fertility?
Those can be affected as well. Low sex hormones, which doctors call hypogonadism, can delay puberty, or later on, make it harder to have children.
And cortisol, that's the stress hormone, isn't it?
Exactly. If the adrenal glands don't make enough cortisol, a condition called adrenal insufficiency, people can feel constantly drained. They might have low blood pressure or feel dizzy when they stand up quickly.
And then there's calcium balance. How does Mito affect that?
Low levels of parathyroid hormone. Doctors call this hypoparathyroidism. can drop calcium in the blood. That can lead to tingling around the mouth, muscle cramps, or just feeling very fatigued.
So these hormone-related symptoms are seen in KSS, but they can appear in other types of Mito too, can't they?
Yes, that's right. While KSS is the type most often linked with hormone problems, other types of Mito can affect the hormone system too, just in different ways or to different degrees.
We've covered a lot of organs, but one we haven't touched on yet is the kidneys. They're also very energy hungry. What can happen there?
Kidneys act like filters. They clear waste, balance fluids, and even help make red blood cells. In Mito, they can be affected in different ways. Fanconi syndrome is one example. The kidney's small tubes don't reabsorb important molecules like phosphate and glucose. That can cause weak bones, growth problems, and frequent urination. Tests show those substances leaking into the urine. Another is nephrotic syndrome, where the kidneys leak protein into urine, causing swelling, especially in the legs and around the eyes.
We've talked about muscles, brain, eyes, heart, gut, hormones, and kidneys. Can you pull it all together for us, just to give listeners a clear summary before we close?
Here's the big picture. Symptoms are what people feel, like fatigue, blurred vision, or tingling. Signs are what clinicians can measure. Things like an abnormal ECG, high lactate, or changes to the optic nerve. In Mito, low energy shows up in the organs that work hardest. Muscles with weakness and fatigue, eyes with droopy lids, poor movement, or sudden vision loss, brain and nerves with seizures, poor balance, or nerve pain, heart with weak pumping or rhythm changes, and hearing loss, which is common too. The named types of Mito are really just clusters of these features.
So if there's one message listeners should take away, what would it be?
That Mito isn't one single set of symptoms. It's a spectrum of signs and symptoms that affect how the body makes and uses energy. And when energy is low, the organs that need the most, like the brain, muscles, heart, and eyes, are the ones that feel it first. By breaking down what the symptoms are, what they mean, and how they affect daily life, we make Mito easier to understand.
That's a strong summary. But before we wrap up, can we talk about why recognizing these signs and symptoms early really matters?
Absolutely. While there isn't yet a cure for Mito, early recognition of symptoms makes a huge difference in the day-to-day management and quality of life. It helps doctors put the right supports in place. Things like managing seizures, monitoring the heart, protecting nutrition, or supporting vision and hearing. It also helps families plan ahead and connect with allied health professionals, like physiotherapy or speech therapy, before symptoms become more limiting.
So it's not just about naming the symptoms, it's about what happens once we know they're there.
Exactly. Think about a child who's starting to lose balance because of ataxia. If that's spotted early, they can begin physio to strengthen muscles and reduce falls, or monitor heart rhythm changes. If they're picked up on an ECG before fainting spells start, treatment can prevent serious complications. The same goes for swallowing difficulties. Recognizing them early means safer eating strategies can be put in place before chest infections develop.
It's a lot to take in. Hearing about so many possible signs and symptoms can feel overwhelming. But just because a sign or symptom is linked with the type of Mito you or someone you love has, it doesn't mean you'll develop it. Mito is different for everyone, even within the same family.
That's right. And what matters most is noticing your own pattern and changes over time. Paying attention to what's typical for you and speaking up when something shifts is powerful. With the right information, early recognition, and a supportive team, people and families find ways to adapt, build routines that work, and keep doing the things that matter. There's real strength in understanding your symptoms and using that knowledge to shape daily life.
If you want to learn more, the best place is the Mito Foundation website. You'll find plain language resources that explain different symptoms, how they connect to types of Mito, and what supports are available. So whether you're living with Mito, supporting someone who is, or just want to understand more, there are trusted resources out there to guide you. You've been listening to MitoCast by Mito Foundation. To learn more or find support, visit mito.org.au or call our helpline on 1300977180. Make sure you follow MitoCast wherever you listen to this podcast to help us spread the word by sharing it with others impacted by Mito. Thanks for listening.